Uganda is improving healthcare service delivery and data management by centralizing all healthcare data systems into the National Data Warehouse, enhancing response to public health events.
It's basically a repository of data that would support us in streamlining how we access, ensure quality, and use health data across multiple health domains, including, of course, epidemic intelligence, among others. It will also support us in streamlining governance of health data, enabling responsible access and use. It does this through a process that involves marshalling data from multiple sources, but also integrating it to enable users of data have a unified user experience in terms of data use.
Data flows into the warehouse from various systems through APIs, SQL queries, and streaming platforms, seamlessly bringing in vital information from across the country. The data is further processed to produce various information products for visualization, which aid in evidence-based decision-making.
So coming up with an information product really begins from talking to the user departments. They tell us what they want to see, the kind of report or dashboard that they want to have built, the different specifications that they want. And in that process, we come up with the user requirement document. Basically tells us the scope, where this data is going to come from, the different visuals, and everything that needs to be in that report. So we've created a number of reports and dashboards, notably includes the surveillance dashboard. We have the community health report, the national community report that also comes from the National Data Warehouse. We have diarrheal diseases report, and these have already gone out to the different user departments. We have a non-communicable diseases report. So for PDF reports which are weekly or monthly, these are scheduled and automated to go out when the time comes. Then we also have dashboards which require user credentials to log in and access. But then we also have these other web applications which are free to visit, but most of them are really require user authentication to access.
It improved our capacity, storage capacity in the Ministry of Health data center. One is it supported us with DR and access with the storage appliance and backup tapes. We are able now to have some of our essential data backed up in our backup tapes, which can support us with, in case of any disaster or incident, we can easily go back to the backup tapes and retrieve the data. Beyond supporting the data warehouse system, we're also supporting our previously hosted systems in the data center. We are now being able to have backups run on the data warehouse infrastructure as well. And we are now certain that in case of an incident, we have where to run to. I can also say that it has helped us to improve security. With the FortiGate firewall, you know, it has advanced security features, and this has enabled us, enabling us to improve our security. And we are sure that in case of any attack, we are certain that we're at a certain level we are protected from any attack.
So the key benefit is that it eases data use and triangulation. It ensures that users of data don't have to deal with multiple links and databases, but can find all the data that they need to use in a single place, significantly easing their data use. But also it allows us to develop what we call hybrid information products, where we have information products that are a result of data integration of data that is collected using multiple processes or from multiple locations. But then those that use it can access it from a single information product facilitating a richer experience in terms of insights.
I'd like to acknowledge the Minister of Health for your leadership, for the Minister of Health in ensuring that Ugandans are getting good quality services and all partners are really on the table to make sure that they contribute towards that. I want to also appreciate the Permanent Secretary, Dr. Diana Twine's mission and vision around data modernization and making sure that we work closely with you to ensure that this work really bears fruit. The Commissioners, Dr. Sarah Jhpiego and Dr. Alan Muruta, for your leadership, to the team and your technical support, which has been really invaluable during this whole process. Assistant Commissioner Paul Mbaka, you and your team have been awesome, and your passion to lead data modernization through HIV, COVID-19, Ebola viral disease response, and currently under the MPOX drive have been quite astronomical in a way that it has advanced the use of digital health information systems. The Ministry of Health IT team, led by Flavia, you have been awesome in the installation, configuration, troubleshooting, and all the other processes as we develop the equipment lists and specifications, the back and forth that we really went through. I'd like to give out shouts to CDC, Atlanta, and Uganda teams, which have been there with us, co-creating and working through different areas. Your technical support has been invaluable, and as well as the CDC implementing partners who work in the health informatics domain, whom we have worked with to create a team of digital analysts and visualization experts who have really worked with Paul and his team to make sure that this work really comes out. I acknowledge all of you and thank you. I want to thank you all for God and my country.